How to investigate infection/exposure to toxin does not equal disease. Difference in disease incidence and severity due to host factors, environmental factors, agent factors, nutritional factors. Therefore, concentrate on the identification of circumstances under which problem occurs. Spatial patterns. Which pastures, feedlots, barns, etc. affected? Is the condition confined to neonates? Is the condition confined to neonates, nursing animals, weanlings, yearlings, adults? Who noticed the change in the animals? How often are the animals evaluated? Plan. Case definition. Define affected animals. Avoid including animals that may be sick from. Avoid including animals that may be sick from other means. Confirmation of outbreak. Attack rate equals number of new cases / total animals at risk. Would 5% open at preg? Check be a problem. Necropsy. Consider sending to diagnostic lab. Call lab for suggestion on samples. How to ship. Remove brain, freeze formalin. Better to send too much than too little. Send suspected toxic plants for IV tissues, blood, CSF, aqueous humor, urine. Clostridial myositis. Gas gangrene of primarily skeletal muscle but also cardiac muscle, uterus. C. Chauffouri, C. septicum, C. disorderly. More common in young stock, triggered by muscle damage, long hauls, chute work, cattle prods, riding activity, etc. Cattle over 2 years develop resistance to C. Chauffouri. Exception to the rule. Sudden death most common from systemic toxemia but may have some lameness, high fever. Physical exam or necropsy. Swollen muscles of the thigh, rump, shoulder, neck or brisket from subcutaneous emphysema that crepitate for edema, first warm, then cold. Skin discolored. Other necropsy lesions. Square and fascia red and gas-filled muscle, light and dry in center, dark and moist. That periphery, gas-filled and spongy if fresh carcass. Clear demarcation in muscle may be evidence of pleuritis, myocarditis. C. Perfringens type A, B, C, and D. Death can precede any signs of enteritis, and death can precede any signs of enteritis and usually does. PASTEURELLOSI. Young calves or naive older animals can die suddenly from pneumonic pasteurellosis with no preceding clinical illness, especially during hot weather, most likely due to toxin production. Cattle don't usually have snotty noses, more likely to have excess salivation, foamy mouth. They NAPLASMOSI. Venoplasma marginal, intraerythrocytic parasite, more common in southern states. Acute anemia, sudden death if clinical signs noted: pale, icteric mucous membranes, depression, anorexia, severe drop in milk production, respiratory distress, bizarre behavior, belligerent. Due to hypoxia, severity of disease increases with age. Anthrax necropsy. Black tarry exudates from body orifices, failure of blood to clot, incomplete rigor mortis, and splenomegaly. Wear gloves and mask. Necropsy. First animal for diagnosis but not subsequent dead to decrease environmental contamination if suspected. Can be diagnosed without necropsy by blood smear. Treatment: antibiotics, supportive care, unrewarding prevention, vaccine available for endemic areas, withdrawal equals 60 days. Heat stroke necropsy. brain edema and hemorrhage treatment. Cool off with water fans, ice packs, etc. Cool off with water fans, ice packs, etc. Steroids to decrease brain edema. IV lightning strike/electrocution if animals insured against accidental death. Company will want veterinary certificate. Necropsy can be difficult to diagnose. No evidence of struggle. No evidence of struggle. Cut in mouth, singeing of the hair in a straight line, early rigor, congested lungs if alive. Any number of neurologic signs, either central or peripheral or both.
Nghĩ phức tạp. Nam
Lightning
chun nó
strike
có thế nào?
/ accidental death. Company will want veteran bloat diagnosis, stomach tube treatment. For free gas, bloat path tube trocherization if bloat path tube, trocherization if emergency. For frothy bloat, poloxamine, soap prevention, limit grazing, poloxamine, ionophores, increase fiber, ruminotomy. Anaphylaxis. Clinical signs: dyspnea, urticaria, anxiety, shivering, bloat, diarrhea, bizarre behavior. Treatment: epinephrine steroids, antihistamines,